Okay, I think we will get started for the day.
OK, je pense que nous allons commencer la journée.
And we can go to the slide. Well, welcome everyone to this event today. We have been looking forward to it with great anticipation.
Alors, bienvenue tous et toutes à l'événement d'aujourd'hui. Nous avons attendu très impatiemment à ce que cela ait lieu.
As I mentioned before, we have some challenges with our interpretation, and therefore we will be doing it as what you hear now. I'll speak English, and it will be directly translated into French.
Comme je l'ai déjà dit, nous avons malheureusement en ce moment des problèmes avec l'interprétation simultanée, raison pour laquelle vous entendrez les choses comme maintenant. Je vais dire quelque chose en anglais, après quoi cela sera traduit vers le français.
And there are people working on it, so hopefully we can have it solved soon, and you will be hearing a conversation with a bit more flow.
Et donc, nous avons des gens qui sont en train de travailler à cela. Donc, espérons qu'ils puissent le résoudre et tout va se passer sans couture plus tard.
On the slide, you see some information about the Secretariat, the people that have been working very hard on the work leading up to today's event.
Sur la diapo, vous pouvez voir de l'information concernant le secrétariat. Il s'agit de personnes qui ont travaillé très fort pour que cet événement ait lieu.
And this is the Kids, the Center for Global Child Health. They have been the Secretariat of NCD Child from January 2020, and they are a dedicated center for activities focused on global child health.
Et vous voyez ici qu'il s'agit de NCD Child, de Sick Kids, en fait le centre Center for Global Child Health de Sick Kids, qui est avec NCD Child depuis le mois de janvier de 2020 et travaille à des activités concernant la santé mondiale des enfants.
And this event is organized by NCD Child, and you see our logo down there in the bottom left. And my name is Maria Hauerslev. I'm a medical doctor, but I'm also the chair of NCD Child. NCD Child is a global multi-stakeholder coalition championing the rights and needs of children living with or at risk of non-communicable diseases. And we're currently based at Sick Kids.
Donc, vous voyez notre logo au bas de la diapo. C'est un événement organisé par NCD Child. Et moi, je m'appelle le docteur Marie Hauerslev. Je suis docteur en médecine et je suis aussi la présidente de NCD Child, qui est une coalition de parties prenantes multiples qui défend les droits et les besoins des enfants, adolescents et jeunes qui vivent avec ou sont à risque de développer des maladies non transmissibles.
And then thank you to our AstraZeneca or the AstraZeneca Young Health Program for their ongoing support to our NCD Child activities.
Je veux aussi remercier le programme Santé des jeunes de AstraZeneca pour leur soutien continu à nos efforts.
I would also like to sincerely thank our excellent partners and co-hosts for this event today, the South Africa NCD Alliance and the Ghana NCD Alliance.
Je voudrais aussi remercier très sincèrement nos partenaires et co-hôtes qui sont si excellents. Il s'agit de l'Alliance sur les maladies non transmissibles de l'Afrique du Sud et l'Alliance sur les maladies non transmissibles du Ghana qui sont ici avec nous aujourd'hui.
And now I believe Vicky from the South Africa NCD Alliance would like to say a few words.
Et maintenant, je pense que Vicky de l'Alliance sur les maladies non transmissibles de l'Afrique du Sud voudrait nous dire quelques mots.
Greetings. Thank you so much for joining us and for this wonderful partnership between NCD Child, the Ghana NCD Alliance, and South Africa. All I wish to say is thank you to everybody who's participated and given their time. And I'm going to stop now because of the translation, but have a wonderful journey together today. Bye-bye.
Je veux saluer tout le monde, je veux remercier tout le monde pour bien avoir voulu nous rejoindre, c'est-à-dire NCD Child, l'Alliance sur les maladies non transmissibles de l'Afrique du Sud et l'Alliance sur les maladies non transmissibles du Ghana. Et c'est tout ce que je désire de vous dire. Je vous remercie de participer, de donner de votre temps. Et maintenant, je vais arrêter à cause de la traduction et au revoir.
And now we'll hear from our other great partner, Labram, from the Ghana NCD Alliance.
Et maintenant, nous écouterons notre autre grand partenaire, Labram, de l'Alliance sur les maladies non transmissibles du Ghana.
Yes, good morning, good afternoon, good evening. Well, I wouldn't know what to say, but I'm happy that we have been able to connect today, being the first day. And just as Vicky said, I'm also happy that we are collaborating in this effort together with the NCD Child and the South African NCD Alliance. I only want to wish all of us the best of the next 2 days so that we can have a very fruitful discussion. So please contribute your quota as much as you can. Over.
Bon matin, bon après-midi, bonsoir, ça dépend d'où vous êtes. Je voudrais dire que je suis très content qu'on puisse être en connexion aujourd'hui et tout comme Vicky, je suis très content du fait qu'on puisse avoir des efforts de collaboration avec NCD Child et l'Alliance sur les maladies non transmissibles de l'Afrique du Sud. Et j'espère qu'on ait de très, très bonnes journées aujourd'hui et demain. Et je vous prie de participer à la discussion que nous devrions avoir.
Okay, and now we will be moving on to a video from the UN Food Systems Summit. And since this meeting today is an independent summit dialogue, and which is an opportunity for organizations and individuals like us who are working on malnutrition in all its forms to amplify their voices and ensuring access to nutritious food for young people.
Et maintenant, nous allons vous montrer une vidéo concernant le sommet sur les systèmes alimentaires des Nations Unies. Il s'agit en fait ici d'une concertation indépendante pour le sommet et nous avons donc l'occasion pour que des organismes et des personnes individuelles qui travaillent à la malnutrition sous toutes ses formes dans l'Afrique sous-saharienne puissent amplifier leurs idées pour assurer l'accès à des aliments nutritifs pour les jeunes.
Unfortunately, this video is only in English, but we will be playing it in English and then we'll continue with our meeting translated.
Malheureusement, cette vidéo n'est qu'en anglais et donc on va vous la montrer seulement en anglais et après cela, nous continuerons avec notre événement traduit.
Your Excellencies, colleagues and friends, as you know, last year the UN Secretary General called for a food system summit to unleash the power of food to drive progress across all 17 United Nations development goals. I thank you for stepping forward to become a leader for the food systems change. These dialogues bring together people from all parts of society to share evidence, experience, and new ideas. Food is powerful. The food we eat brings us together as families, as communities, and as nations. It underpins our culture, our economies, and our relationship with the natural world. The world's food system touches every aspect of human existence, which makes them valuable instruments of change. The reason we are having a summit this year and the reason we are here today is because we are off track. We are not set to achieve on our shared vision and goals for the 2030 agenda. Our food systems have staggering levels of inequality. Our key priority for this summit is to bring more inclusive, equitable, and healthier food systems while also safeguarding our planet. These dialogues are a core element of the summit process. They are an opportunity to come together and identify priorities and actions to be taken for a better future. This will be a people's summit, but it will also be a solution summit because everyone is part of the food system. We are looking to get all of you and your ideas around the table to ensure that action is owned and driven by different actors. We want action to be driven by you. Your leadership and ability to have courageous conversations rather than avoid them will be very critical. If we can't have courageous conversations about what needs to change and how we need to work together, then we won't be able to go very far. We need each of you to determine the food system you want for your future and to act on it to make them a reality. We must do this understanding fully well our place in the world and that what we do as individuals impacts on others. I look forward to working with you in this summit process. Together, we can build a world of inclusive growth, environmental sustainability, and social justice. We can build a resilient world where no one is hungry, no one is poor, and no one is left behind. I thank you.
Thank you. I think that was a very good start for the more content-focused part of today.
Merci. Je pense que ceci fut un très bon départ pour les efforts que nous allons faire aujourd'hui.
And in NCD Child, we're gathering all of you here today because we're concerned about children and young people's lives and how the inadequate food system that we're all part of will have a lasting impact on their health and well-being for many decades to come.
Et encore une fois, ici à NCD Child, nous sommes en train de vous rassembler tous et toutes parce que la vie des enfants et des jeunes nous inquiète et nous savons que l'alimentation inadéquate pourrait affecter leur santé pour les années à venir.
So I and the team really look forward to sharing today with you all.
Donc, moi-même et l'équipe attendons avec impatience de pouvoir partager avec vous tous et toutes.
And first, we will have, as you see the agenda here today, we will have an opening keynote. Then we will have a plenary panel with a Q&A session, and I hope you will participate actively in this. And then we will go into breakout session where we will really hear from you and learn from your expertise.
Donc, nous aurons tout d'abord une oratrice principale, après quoi cela sera suivi par une foire aux questions. Et ensuite, vous partirez dans des petits groupes de discussion où vous pourrez partager vos connaissances et votre expertise.
And now we will move on to some housekeeping.
Passons maintenant à des enjeux logistiques.
So before I introduce our keynote speaker today, I'd just like to cover a few housekeeping topics. First of all, please ensure that you're on mute when you're not speaking. And also today's opening keynote and plenary panel will be recorded, and we'll be able to share a link with you after the event is complete. And we also welcome you to revisit the content yourself and share it with your colleagues. And lastly, we invite your comments and questions after our panel, and please use the chat box to submit your questions, and we will try to address all questions time permitting.
Donc, avant de vous présenter notre oratrice principale, je voudrais couvrir quelques enjeux logistiques. Tout d'abord, assurez-vous d'être en sourdine. Et puis, en plus, l'oratrice principale de ce matin et le groupe d'experts sont en train d'être enregistrés. Et nous pourrons partager donc un lien avec vous après avoir complété l'événement. Nous vous invitons à partager et à passer en revue le contenu vous-même et à le partager, comme je le disais, avec des collègues. Nous invitons vos commentaires et vos questions après le panel et veuillez bien utiliser la fonctionnalité de la foire aux questions sur votre écran pour soumettre vos questions et nous essaierons d'attaquer toutes ces questions quand on aura et si on aura le temps de le faire.
And now moving on to our keynote speaker, which we are so pleased to have join us here today. which is Catherine Ndinda. She's a social scientist and currently a research director in human and social capabilities at the Human Science Research Council in South Africa. She holds a PhD in social science and MSc urban and regional planning and development. Her research is increasingly focused on policy analysis and evaluation in human settlements, non-communicable diseases, and HIV and AIDS. In policy analysis, she has been involved in the analysis of non-communicable disease prevention policies in Africa, a multi-country study involving Cameroon, Kenya, Malawi, Nigeria, and South Africa, funded by the IDRC. The findings from the ANPPA work were published in a special edition of the MBC, and her current research focused on the coherence of agro-food policies with NCD prevention policies in South Africa. She's a member of the South African NCD Alliance and Habitat for Humanity South Africa. Together with colleagues, she has begun to focus on COVID-19 and recently published a brief research article focusing on the impact of media reporting of the pandemic in the city of Cape Town on mental health. She's been a PI in more than 20 grants and possesses expertise in research implementation. Her research outputs have appeared in peer-reviewed journals and policy briefs. She has also contributed to research reviews and newspaper articles.
Catherine Ndinda est une spécialiste des sciences sociales et actuellement directrice de recherche en capacité humaine et sociale au Human Science Research Council en Afrique du Sud. Elle est titulaire d'un doctorat en sciences sociales et d'une master en planification urbaine et régionale au niveau de développement. Ses recherches sont de plus en plus axées sur l'analyse et l'évaluation des politiques en matière d'établissements humains, de maladies non transmissibles et de VIH et de SIDA. Dans le domaine de l'analyse des politiques, elle a participé à l'analyse des politiques de prévention des maladies non transmissibles en Afrique, une étude multi-pays impliquant l'Afrique du Sud, le Cameroun, le Kenya, le Malawi et le Nigeria, financée par le CRDI. Les résultats des travaux de l'UNPPA ont été publiés dans un numéro spécial. Ces recherches actuelles portent sur la cohérence des politiques agroalimentaires avec les politiques de prévention des MNT en Afrique du Sud. Elle est membre de la South African NCD Alliance et de Habitat for Humanity Sud-Afrique avec des collègues. Elle a commencé à s'intéresser du COVID-19 et a récemment publié un bref article de recherche sur l'impact de la couverture médiatique de la pandémie dans la ville du Cap sur la santé mentale. Elle a été chercheuse principale dans les plus de 20 subventions et possède une expertise dans la mise en œuvre de la recherche. Les résultats de ces recherches ont été publiés dans des revues évaluées par des pairs et dans des notes d'orientation. Elle a également contribué à des revues de recherche et à des articles de presse.
Our keynote speaker today will be speaking through a video which is recorded in English, so unfortunately it will not be translated, and the same will be for our panelist speakers that we will have later on. If we do not have the French interpretation Zoom input set up by then, we have decided to not continue with this translation. We apologize.
Bon, la conférencière va donner son discours par vidéo. Alors, je regrette qu'on ne peut pas offrir l'interprétation consécutive. C'est la même chose avec quelques-uns de nos panélistes. Alors, je suis vraiment désolée, mais on ne peut pas vous offrir l'interprétation. Nous avons décidé de ne pas continuer avec cela pour le moment.
And now we'll see the video from Dr. Catherine Ndinda.
Et maintenant, on va jouer le vidéo de la Dr. Catherine Ndinda.
Okay, good afternoon. This is Catherine, and we're presenting in this workshop on the double burden of malnutrition in Sub-Saharan Africa, engaging the youth in access to nutritious food. So whereas this is the main theme of the workshop, we present on a different topic. So today we are presenting on the coherence of agro-food policies with NCD prevention policies in South Africa. So whereas the work has been done by a team of people, I'm the presenter and I represent all the others. This is the group of people that worked on the study, and there are others, but these are the ones that have contributed to this part. In terms of the background, we argue that the agricultural sector determines what the general population in South Africa consumes. Commercial production determines the varieties, quantities, quality of fruits and vegetables available for consumption at household level. In South Africa, food security is considered one of the major achievements. It is as a food secure country. That means it has sufficient production of the staple food and the country is able to import when there are shortages. Food security level at the household level remains a challenge. The inability of households to afford healthy foods such as fruits and vegetables inevitably drives them to consume what is affordable and not necessarily what is nutritious. These are often processed foods which are high in salt and fat content. In terms of the global context, we note that unhealthy diets are risk factors for non-communicable diseases such as cardiovascular diseases, cancer, hypertension, stroke, and kidney disease, among others. Now, we also note that agro-food policies often focus on undernutrition. In our context, the Food and Nutrition Security Policy notes that 13.5 million South Africans are food insecure. South Africa, like low-income countries, is faced with the triple burden of undernutrition, HIV, and NCDs. Then last year, COVID came into the picture. However, today we will still continue to focus on the coherence of agro-food policies with NCD prevention in South Africa. What do we mean by policy coherence? We note that it is achieved when policies across a range of domestic areas support or at least do not undermine the attainment of development objectives. In our case, policy coherence for sustainable development in the current study notes that the food and agricultural policies on fruits and vegetables should be able to support NCD prevention in this country. So we also note that in terms of coherence, agro-food policies align with the Constitution, which stipulates that food is a basic human right. The strategic thrust of the food policies in this country is to ensure the availability of safe and nutritious food at the national and household levels. In this study, agri-food policies encompass policies on agriculture, food, and trade policies. All these interact and intersect at various levels, and therefore we look at them as a whole. So having given you that background, we noted at the beginning that we were involved in a study that is looking at the coherence of agro-food policies with the NCD prevention policies. And so we conducted a policy analysis and review that looked at both local and international policies on agriculture, nutrition, food security, and NCDs. We conducted 35 key informant interviews, and these were conducted in different provinces, that is Gauteng, KZN, and Mpumalanga. We also looked at the different policies, those are the national and the policies at the district and provincial levels. At the district levels, there aren't specific policies in all cases, but there are programs. We'll look at those two for analysis. In terms of the findings we have so far, we were able to identify and review a total of 63 policies and programs. We reviewed agricultural policies for any relevance, linkage, or alignment with the production and consumption of fruits and vegetables. We assessed the alignment with NCDs, that is, the mention of fruits and vegetables, the mention of nutrition, and also health. In terms of coherence, we noted that if those policies were in support of improved nutrition and health, then we considered them to be coherent. Lack of coherence was identified where there was no mention of nutrition or health in the policy or program identified. And therefore, the agricultural policies were assessed against the objectives of NCD prevention and control in South Africa. So our findings in terms of NCD prevention and in terms of the policy analysis suggest that 10 of the agro-food policies do support NCD prevention. 19 of the policies reviewed indirectly support NCD prevention. And 18 of the policies are relevant, but are not necessarily directly aligned to NCD prevention. In terms of assessing the alignment of the local policies with the global frameworks, we noted a number of agricultural policies, and we noted that these were aligned to major global frameworks such as the Millennium Development Goals and the Sustainable Development Goals. We take that into further details. In terms of the alignment with the Sustainable Development Goals, we noted that the agro-food policies in South Africa address SDG goal number 2, that is ending hunger and achieving food security, that is improved food security. In terms of that SDG, section 2.2 notes that the objective is to end all forms of malnutrition in children, adolescents, and lactating mothers. So our policies in South Africa do address that specific goal in the SDG. Another relevant SDG in this study was SDG 2.3, which speaks to doubling agricultural production. And that is relevant because locally the policies on agriculture focus on increasing agricultural production in order to ensure increased profits and perhaps prevent NCDs through increased consumption of fruits and vegetables. SDG 3 is relevant to our study. It speaks to ensuring healthy lives and promoting well-being for all. In terms of SDG 3.4, it is the most relevant to this study. And what we note is that it targets the reduction by 1/3 of premature mortality from NCDs. And therefore, what we note is that SDG 2 and 3 are linked. Achieving SDG number 2 is important for attaining SDG 3, that is the one that speaks to the reduction of premature mortality from NCDs. However, we note that poor nutrition does contribute again to the same SDG, that is 3.4. That is, poor nutrition is responsible for the increase in mortality rates from non-communicable diseases. Some of the policies that we identified and noted that they were coherent with NCD prevention are listed in this chart, but we are particularly interested in the Integrated Food Security Strategy 2002 and the National Roadmap for Nutrition in South Africa 2013 and the Medium-Term Strategic Framework 2014 to 2019 and the National Development Plan, that is Vision 2030. All these policies or policy frameworks do speak to the prevention of NCDs, and even if they relate to agriculture, they encompass notions that actually all contribute to increased consumption of fruits and vegetables for NCD prevention. Looking at the one specific policy, that is the National Food and Nutrition Security Policy, we note that it promotes food security and improved nutrition. Some of the programs under the Department of Land and Rural Development, which is the mother institution for the National Food and Nutrition Security Policy, include Lima Letsema. The Lima Letsema program targets emerging Black farmers and communities. And these communities are vulnerable to various challenges such as the lack of management capabilities, poor skills due to lack of training, lengthy procurement processes, and severe drought conditions. The Lima Letsema program seeks to cushion farmers from the challenges that are listed and to assist them to improve the production of outputs. When we interviewed some of the key informants regarding the National Food and Nutrition Security Policy, they said, the policy helps South Africans in terms of how it addresses food security in the country, and it promotes issues of proper nutrition and all that. So that's a key informant interview that we are quoting. So another policy is the Integrated Food Security Strategy, which we will not go into because we want to focus on the school nutrition program. The National School Nutrition Program is part of the Food Security Strategy 2002, and it's one of the programs under that strategy. The purpose is to alleviate hunger among learners. It is also meant to alleviate macronutrient deficiency. It is one of the incentives for children to attend school, and it helps in enhancing the learning capacity of learners. Poor learners from grade R to 7 are provided with meals. In the areas where learners are poor, all the learners are fed. The meals are provided for a number of 156 out of 196 days per year. Now, so that's a large proportion of learners that are provided with meals that are supposed to be nutritious and to contribute to their well-being throughout the academic year. What we note is that with the onset of the COVID-19 pandemic, the lockdown conditions contributed to hunger and malnutrition among school children because most of the children were not at school during the hard lockdown period. However, the government intervened in providing food parcels to households, and that did help in alleviating hunger during the lockdown that came as a result of the COVID-19 pandemic. We, however, note that not all learners were reached. A comment that I need to make here is that we have child-headed households in this country, and when they are not reached by some of those parcels, then that is where we say hunger and malnutrition are on the increase when there is no learning at school. So we asked our key informants about the school nutrition program, and they provided a critique or an assessment of the program. What they noted is that it promotes the consumption of fruits and vegetables for health purposes and the eradication of poverty and malnutrition. They, however, noted that there's a need to distinguish between a nutrition school program, and it should not be confused with a feeding program, which is what is prevalent in schools. A feeding program is only concerned with providing food, that is any type of food to keep children at school. However, a nutrition program pays attention to the nutritional value of every meal served. Now, so having heard that from the key informants who are indeed critiquing the school nutrition program, we note that the school nutrition program is a relevant and useful program. However, the implementation of the program means that it is flawed in certain ways. The program results in feeding kids, and therefore it becomes a feeding scheme and not necessarily a nutrition program. So the focus does become ensuring children get a meal at school. However, the quality and the nutritious level and value of that meal is not always put into the picture. Some of the challenges with the school nutrition program were identified by the key informants that we interviewed, and these include the whole issue of advertising the school nutrition program, and the result of which is that people are given tenders. So the tenders go to the highest bidder, the bidder who has provided the best bid for the provision of meals to school children. The pricing therefore becomes on pricing rather than questions about qualified specialists, that is dietitians, nutritionists, and chefs in the appointment of service providers. The concerns then are related to the consultation of specialists in planning and implementing the nutrition program in schools. The concerns are also about sustained inspections and monitoring for compliance for nutritional value of food, as opposed to simply preparing pap and beans every day. Here, what we mean by pap, it is the staple food in this country. It's maize meal and beans, and that is the staple food that is easy to make and that is familiar to everybody. So when that is provided every day, indeed we are providing meals, but then the question becomes, so where do fruits and vegetables fall in if that is what school children are getting most of the time? So we are concluding at this point to say that where there is a coherence of the policies and where there is alignment of agro-food policies with NCD policies, then we can expect a reduction in the mortality rates of those with NCDs. However, in concluding this discussion, what we are saying is that the objectives of agro-food policies do align with NCD prevention. However, the alignment levels coexist with implementation gaps. What we said earlier was that the design of the policies aligns with the does align very strongly in some of the policies. So you find agro-food policies do align with NCD prevention policies, whose objective is to reduce NCDs and control NCDs. However, the implementation of the agro-food policies results in misalignment, And what we have given here is the school nutrition program. Whereas these objectives do specify the goal should be improved nutrition. However, the challenges in schools result in flawed implementation. And so optimum nutrition and NCD prevention and control are overlooked. And so we conclude this presentation by saying there is need to align for alignment in both the design of the policies and the implementation of agro-food policies so that this can contribute to NCD prevention and control in every context. And here we have given South Africa as an example. However, the same argument can be made in other African contexts, whereby you might find very good agro-food policies that indeed can address NCD prevention policies, because theoretically those policies are robust. However, the way in which the policies are then implemented results in a misalignment of the objectives, and therefore what we are calling for is continuous monitoring and evaluation to ensure the alignment of the policies, but also to ensure the objectives are not forgotten in the process of implementing policies that are meant to address hunger, malnutrition, and improved health, and that includes NCD prevention and control. And that is the end of our presentation. And we say thank you, asante, siyabonga kakhulu. Thank you.
Thank you for that wonderful presentation, Dr. Catherine. I know that you are with us on this call today as well. So for those of you that might have questions, I think that will be possible as well during our Q&A section. Now we'll be moving on to our panel. And here we have three wonderful panelists with us today. We first up, we have, and excuse my pronunciation, Kwaku Omwana Hevesufua Asante, who is the Executive Director of the Agency for Health and Security in Ghana. He's the convener for the Ghana CSO sub-platform on SDG2 and the Project Director of Strengthening Agriculture Value Chain Economics for Sustainable Development, and his research focuses on food and environmentally sustainable systems. Let's hear from Kwaku first, and then I'll introduce the other speakers as we go.
Ok, bon, maintenant nous allons passer à notre panel plénier. D'abord, je voudrais présenter pardon si je le dis mal, mais c'est Kwaku Onwana Hosfer Asante. Il est le directeur exécutif de l'Agence pour la santé et la sécurité alimentaire et membre fondateur des ODD, Africa Independent Assessors, praticienne de la gouvernance et du développement durable, ayant une formation en agronomie et en foresterie. Et please continue, madam.
Yeah, hello, good day. And it's a pleasure to be part of this session. And I think that for some time now, we've been doing some works around food systems and environmental sustainability systems. I think that Mari's activity, France's policy coherence too, has been part of our advocacy activities, and I hope that we'll have a fantastic session interacting. Thank you.
Thank you, Kwaku. And then we will I'll just briefly present the two other panelists. We have Pusi Somoyo, who is a friend and an activist and scholar. He is taking a largely political economy lens, and his current research is focused on human rights and development, the politics of malnutrition, the geopolitics of food and agriculture, global goal setting, and governance by indicators.
Je voudrais juste présenter les autres intervenants, c'est-à-dire les autres conférenciers. Nous avons tout d'abord Busiso Moyo. C'est un activiste et un universitaire dans une lentille d'économie politique, des recherches. Ses recherches actuelles se concentrent sur les droits de l'homme et le développement, la politique de la malnutrition, la géopolitique de l'alimentation et de l'agriculture, la fixation d'objectifs mondiaux et de la gouvernance par indicateurs.
And then lastly, we will be having Dr. Guy Kitze, who graduated as a pediatrician with a Master's of Medicine and is a pediatric and adolescent health fellow of the College of Pediatricians of South Africa. He's currently working as a pediatrician, managing inpatient and also running outpatient services at Francistown Academic Hospital in Botswana. And Dr. Guy Kitze has been involved with the American Academy of Pediatric Programs as the champion against tobacco use since February 2020. And he's currently working on the AAP-sponsored work on the prevalence of tobacco use in school-going adolescents in cities in Francistown and Gabor in Botswana.
Alors, le docteur Guy Kitze s'est diplômé comme pédiatre avec une maîtrise en médecine pédiatrique et en santé des adolescents et est boursier du College of Pediatricians of South Africa de l'université de Witwatersrand à Johannesburg en Afrique du Sud. En 2017, il s'est diplômé. Il est en ce moment en train de travailler comme pédiatre qui gère des malades hospitalisés et il est aussi à la charge des services de consultation externe à l'hôpital universitaire Francistown à Francistown au Botswana. Le docteur Guy Kitze a été impliqué au programme de la American Academy of Pediatrics comme défenseur contre le tabagisme depuis février de 2020, après avoir participé à un atelier de défense des droits et de mentorat au siège social de la American Academy of Pediatrics. Cet atelier s'est appelé « La protection des enfants contre le tabagisme », atelier de la promotion du leadership. Il est en ce moment en train de travailler à du travail commandité par la American Academy of Pediatrics concernant la prévalence du tabagisme dans les écoles, chez les adolescents dans les villes de Francistown et de Gaborone au Botswana.
And now we will move on to our first speaker, Kwaku Onyaya Asante, and please share your reflections with us and let us know when to change the slides.
Et maintenant, nous allons passer à l'orateur Kwaku Onwona Hwesufura Asante et faites-nous savoir, je vous prie, quand vous voulez que nous changions les diapos.
And before you start, this part will unfortunately not be translated into French, but we hope to provide a translation after the workshop.
Et avant que vous ne commenciez, cette présentation ne sera pas interprétée, mais nous espérons pouvoir vous fournir une traduction après l'atelier. Merci.
Yeah. Okay. Yeah. So thank you for the opportunity once again, and good day to all participants and colleagues, facilitators. Yeah, talking about food systems and NCDs, we noticed that there are major challenges that require more action than talk. In fact, I read a work done by Francisco et al. In 2019, and I get amazed by the kind of statistics they put. For instance, Francisco et al. Presents that cardiovascular and respiratory diseases, cancers, diabetes are responsible for 71% of global deaths, which is about 41 million each year. And if every life matters and 41 million people are dying out of NCDs, we can't be sitting here talking, but to begin to act and taking more actions than speak. They also present that among this 41 million, 85% of the premature deaths from NCDs occur in low and middle income countries. And they further say that, you know, the globally 1 in every 3 persons suffer at least one form of malnutrition. And this is likely to exacerbate to about 1 in every 2 persons by 2025, which is threatening, which is quite fearful. And if about 151 million children are stunted and about 38 million children under 5 are currently overweight, at the risk of NCDs, then in fact, this discussion is far more relevant than ever. So we need to particularly focus on which actions that need to be taken to resolve these challenges, particularly as we focus on low and middle income countries in Africa. So I believe that these interactions that we have will go a long way to provide more practical means of getting these resolved, so that we don't come here back sitting to talk about a problem, but to talk about how far we have advanced solutions to dealing with these problems. Thank you very much.
Thank you so much, Kwaku. And now we'll move on to Pusi Sumoyo.
Hi, everyone. There we go. Okay. Thank you all. My name is Pusi Sumoyo, and I am coming live from Johannesburg. However, I am a student. I'm a doctoral candidate at the University of the Western Cape out in Cape Town. So thank you, everybody, for affording me the opportunity to just share with you some of my thoughts this afternoon. I was told that I have 5 minutes. So in my head, how this is going to play out is just that this will be just provocations more than anything else that will perhaps we can then build on in terms of the Q&A and perhaps even more so in the breakout rooms. So just perhaps as a point of departure, my experience speaks more closely, to the South African story. And my concern in particular has to do with the issue of, the politics of malnutrition. It's talking about constitutionalism and what that provides insofar as our posture in terms of grappling with the dual burden of malnutrition. And from then on, then the next question becomes, what are the indicators telling us? Because as we can see from the introductory keynote is that, we have a very vibrant policy environment in South Africa as a case in point, but why is it that we're still not delivering insofar as the right to food is concerned, particularly when we look at what that means for the children. So when we look at those indicators, statistically speaking, what is that telling us? And particularly as a result of that, that then draws us to this environment that I'm concerned about, which is ultimately the politics of malnutrition. But what about the politics of malnutrition? And I think it's a bit odd that, leading up to this point in time, we haven't even made reference to the fact that we are speaking about some of these challenges in the midst of the UN decade of action on nutrition. So that is a cycle that started in 2016, and we are like 4 odd years away from that coming to an end. That is 2025. And leading up to the Food System Summit, part of the challenge then, I think, that I want to bring forward for us as public health practitioners and scholars and activists is that You know, all too often I believe that we're too consumed with seeking to influence and change the behaviors of the powerless. And I think it's about time, you know, we change our posture and start interrogating how we can influence, you know, the political economy and seek to somewhat change the behavior of the powerful, so to speak. Yes, and with that said, please, can I just go to the next slide? So part of the problem then becomes, you know, we've got this human rights-based framework in South Africa that forms part of our heritage, and that's part that forms part of our, you know, the sort of appetite that we bring when we're talking about some of these policy issues and where some of the bottlenecks lie. But ultimately, I think, you know, leading up to an occasion such as the Food Systems Summit, you know, it's about holding the space and trying to get rid of assumptions. And what am I talking about here? I think all too often we play lip service to the, and we assume that it's a given that everybody is on board and understands what we're talking about when we, you know, when we reference this idea of a right to food and nutrition. And I think because we can realize that even as we speak, there's current pushback, right, in terms of how, you know, most of us food activists and scholars are seeing that space, you know, being, you know, sort of like consumed in the build-up to the actual summit. So what I'm getting at is that we have an opportunity here to hold the space and ask ourselves some very complex questions. What does the right to food mean for the agriculture sector? What does the right to food mean for us as health practitioners who are looking to advance a particular lens in terms of unpacking the problem? And building on the fact that perhaps because of this complexity that is attached to food systems, could it be that we are now at a point where we should be speaking of a standalone right to nutrition in light of some of these concerns that are specifically, you know, have to do with the public lens in terms of this work. Next slide, please. So part of that, at the end of the day, you know, we're talking about power, we're talking about politics, and that's discursiveness, you know, that's discursive power. It's not really clear, it's about advocacy. And part of that is that perhaps we need to be clear in terms of what is it that we're looking to gain, what is it we're looking to achieve, provided that once this platform presents itself. And part of that speaks to advocacy efforts. You know, are we moving in unison? Do we have a coherent understanding of, you know, the low-hanging fruits? All right. So what is it that we are looking to capitalize on the most insofar as the short term leading up to the long term? Beyond that, where is the leadership located in terms of, you know, these discussions, particularly for us in the global South, you know, leading up to the summit? How is it that we're going to find ourselves with agency beyond the state framework? Because there's a particular statecraft there that we don't understand. And how does that express itself? It expresses itself in the simple fact that we have a vibrant policy environment. We have codified the fact that, you know, we have this constitutional imperative to the right to food in South Africa. And beyond that, we even have a national policy framework, but still, we have these pockets of hunger that whereby even our social safety net does not seem to be able to necessarily respond to. So how then do we bring to light some of these struggles that are unique contextually to a country like South Africa? Beyond that, I'm speaking about complexity, right? So let's hold the space. Let's avoid let's avoid running ahead with assumptions without getting to the core of the matter, which is that let's be cognizant of how virus and different sectors approach and understand this problem. And then lastly, and I think this is the most crucial part, is that we need to get evidence to the right people. So it does not help that, you know, we play lip service to the problem and we speak about, you know, the system not delivering. Truth be told, part of the crisis or part of the problem that I've seen here in South Africa is that we are not even sure what relief we're looking for. So if we had to get the right characters, the right actors in the room, what is it exactly that we are trying to tell them? And with that said, I think I will wrap it up. And last slide ultimately speaks once again to this dichotomy that I was speaking about, because also inherent in this conversation is the question of informality. All right, so in a question of, in a context of inequality, what does the policy environment mean for informality, which anchors a large amount of, the food systems in the world? And how then do we also address and intervene within that sector to ensure that it speaks to some of these nutritional outcomes that we want to place at the forefront, without also formalizing that space? So that's part of the complexity that I'm talking about, and maybe that can then express itself in us talking about a right to nutrition. All right, thank you, everybody.
Thank you so much, Patricia. Very inspiring and great to have a young speaker. That's something that in NCD Child we value very much, youth participation. You'll also see that there are quite a few young people on this workshop in general here today.
Merci beaucoup. Nous apprécions beaucoup d'avoir des jeunes parmi nous à NCD Child. Vous verrez qu'il y a beaucoup de participants jeunes parmi nous aujourd'hui.
I think you really initiated a good conversation that I hope will continue in the breakout sessions.
Je pense que vous avez initié une très bonne conversation que j'espère continuera pendant la réunion des petits groupes.
And now we move on to Dr. Mosiso Gaikitse. Please go ahead.
Et maintenant, nous allons passer au docteur Motusi Gaikitse. Veuillez bien procéder, le docteur.
Good afternoon, everyone. It's a pleasure to be here. My name is Motusi Gaikitse. I'm a pediatrician. I'll be actually looking into the double burden of malnutrition in Sub-Saharan Africa, but mostly I'll be looking into the association of tobacco use and poor nutritional status in children. So as a pediatrician, I'll be actually looking into the different stages of child growth and how it is affected by exposure to tobacco. For starters, tobacco use, we know, is a public health concern, and it has serious health problems worldwide. It is also the leading cause of preventable diseases, disability, and death worldwide. Like I said, we pediatricians, we focus mainly on making sure that children grow to become responsible adults. So we know that the future of every nation depends on the status of their children at the particular moment. For instance, for the first 8 years of child development, that is very fundamental. It's very important as a foundation of a lifetime. Of this, the first 3 are very critical for the brain development. Next slide, please. During pregnancy, tobacco use has many other effects. And we know that tobacco exposure is an early key driver of inequality. During pregnancy, an unborn child who is exposed to maternal tobacco use could either be the mother using the tobacco or as a second-hand smoker. This has been shown to actually lead to severe birth defects, stillbirths, and premature births, and also reduced child survival. When the mother uses tobacco, there is increased risk of birth defects. Actually, half of the patient there's actually double the risk of birth defects when a mother is using tobacco as a first-hand smoker. But when also the mom is using tobacco as a second-hand smoker, there's a quarter increment in stillbirths, and about 13% will have birth defects. So we can actually see that tobacco is actually toxic because some of the components of tobacco, we have benzene there, we have formaldehyde, the nicotine, which is quite teratogenic, and that is very much dangerous in the sense that it also causes cancers. For instance, also secondhand smoking, it increases the risk of malignancy in children, especially leukemias. Next slide, please. During infancy, when a mom is exposed to tobacco, whether it's a secondhand smoke or she's using tobacco, it has been shown that there's actually high risk of hospitalization for children, mainly because of the respiratory problems. At this stage, bronchiolitis, asthma, and ear infections are very common when there is smoking in the household. all these are very particularly important in the sense that there is reduced amount of spending, which could have been used for purchasing food and making sure that the family is food secure. Instead, most of the money is spent in the hospital bills, while it could actually be used for nourishment of children, for them to grow and attain full potential as adults. Next slide, please. In childhood, there is an increased risk of dyslipidemia, insulin resistance, and diabetes. This is mainly because tobacco, especially the nicotine, is quite inflammatory to the blood vessels. This may actually lead to a cascade of inflammation, which results in disproportionate lipid profile, lipid arrangement in the body. This may lead to a condition called metabolic syndrome, which is associated with insulin resistance, diabetes, and hypertension. So all these conditions in childhood, they can actually lead to childhood obesity and its related morbidities. So we know that children that are obese, there's a risk of actually having sudden heart attacks. They can also have atherosclerosis and its associated like strokes, comorbidities like stroke, and even early mortality. Next slide. We also know that tobacco use, mostly the habit is taken up during adolescent stage. This is very important because many studies have done in the region where it has shown that between 13 to 15%, between 13 and 15 years of age, adolescents use tobacco. In the region, it has been shown that between 12 to 23% of children between 13 and 15, they use tobacco. There was a study that was done by Pelza in South Africa, in Limpopo. He has actually shown that in many countries in the region, for instance, in Botswana, 12% of children between 13 and 15 use tobacco. In Zimbabwe, there were 14%. In Namibia was 23%. In Kenya was about 20%. This actually shows that there is a sudden increment in use of tobacco earlier on in life. So in essence, 70% of children with tobacco users whose parents are actually using tobacco are likely to take up the smoke. There were global studies that were done to actually look into the predictors of tobacco use in early life. And there was actually pointers to which actually made prediction that a child is likely to take up tobacco or the habit. One of the highest contributors was a parent who's actually smoking in the household. So it has been shown that teenagers that live with parents who are smokers are likely to take up smoking as a habit, actually 70% of them. The other indicator was actually accessibility to tobacco smoking. This accessibility to tobacco smokers, to the product themselves. This involves like advertisers of tobacco, or it's tobacco being readily available, like where you can actually go and buy a straw of tobacco, like one piece of tobacco, like a small smoke, like when you can actually go and buy a stick of smoke. That has actually made it very easy to be accessed. And also the other indicators was lack of parental supervision and the use of other substances has also been shown that there's a high risk of a child using tobacco if he's using other substances like taking alcohol, for instance. And it has been shown that children that take up smoking earlier in life are likely to be smokers as adults. And this is very critical because this is the future of the nation. Next slide. In conclusion, adult tobacco use has been shown to be significantly important as it affects the nutritional effect in children. It has a nutritional effect in children, both in short term and long term. So it contributes to hunger and food insecurity. The use of tobacco, it actually affects food insecurity in the household, as mostly you find that there is increased hospitalization risk in children that have parents that are using tobacco. And also, there is a lot of, parents tend to use a lot of money in buying tobacco instead of actually taking care of the households. As such, it diverts the funds from basic household expenses like nutrition, which is essential for childhood survival and neurodevelopment. Also, tobacco use has been shown to lead to both undernutrition and obesity, as already discussed. Thank you very much.
Thank you so much, Dr. Gaikitse. I really enjoyed how you draw those linkages between the tobacco use and the food systems agenda.
Merci beaucoup, le docteur Gaikitse. J'aime beaucoup que vous ayez connecté le tabagisme avec les programmes concernant l'alimentation.
And now we'll move into our Q&A session. And unfortunately, we will not be able to have translation for the questions and answers. But please do submit them in the chat box at the bottom of the screen, or if you would like to speak, you can also raise your hand and I will try to give the word to different people in the room. So if you have any questions to our speakers, please just let us know.
Et maintenant, nous allons passer à la foire aux questions comme session. Malheureusement, nous ne pourrons pas avoir d'interprétation simultanée pour les questions, mais si vous voulez poser des questions, veuillez les mettre au bas de votre écran et je vais essayer de vous laisser parler aussi si vous levez la main. Merci.
Maybe we can also kick it off with a question from our side here in NCD Child and ask the panelists what role you think young people play in lifting this agenda and how we can make sure that more people in the region have access to safe and nutritious foods. And maybe I'll just ask Busiso to go first.
Thanks. Well, look, I guess I get the advantage of speaking as a young person, and I can just speak to my experience in this space. Look, beyond the scholarship and the activism trying to highlight how grave the situation is, I think young people in South Africa in particular are in a special, position because of our unemployment story as well, that runs in tandem with the fact that, how else does one access, the food system if it's not a question of entitlements, income, purchasing power, and so forth? So the current, youth unemployment in South Africa stands at, 70-odd% last I checked. And, that's very worrying. And that's something that, presents itself as well in terms of wondering how it is that young people are coping with the food system in light of the fact that also there's no proper sort of like social security system that is geared for young people in terms of the youth specifically. So, that's something that angers me in particular. And because of that, and I think it's very concerning that there's an absence of collective action, from young people to heighten, and, place demand in terms of saying this crisis is confronting us, and beyond that, to also anticipate the problems of tomorrow, because in as much as we young people today, these burdens, we're going to have to carry them tomorrow. And I think with that said, I think my plea is for more activism, more militancy. It's urgent, and it's going to confront us sooner or later. And before I also wrap up, let's think about the children. Where does that leave them, right? Because at the essence, youth, children, it's one conversation, and right there, we're missing out on a whole lot, and there's going to be ramifications in the short term. So yeah, with that said, my plea is for more activism. Let's all be human rights defenders. Yeah.
Thank you so much, Busiso, and thank you so much also to the questions that are coming in. We will move on to those. For Dr. Catherine and Kwaku and Dr. Gaikitse and Busiso, if you would like to speak, please just unmute and I'll divert the questions. And to all of you asking questions, if you could please let us know also where you're from, and if there is anyone particular that you'd like to have answering your question. But we'll start with the first question here from Foley Solomon. and it goes, who should handle our food situation, the government or the private sector? Do any of the panelists want to speak to that? Kwaku? Would you want to say something, Kwaku, please?
Okay, yeah. Who should handle? Yes, yeah. I think that it's not a simple question as to who handles the food situation, because when you consider the role of government, the government is supposed to provide an infrastructure for the policy. The government must provide the policy environment and then establish the infrastructure. But then the private sector too must be regulated, because they are for business and must at all costs be regulated in their act of trying to make profit. Sometimes in considering the economics beyond productions, people to dilute the nutritional base of food systems. So we need to be able to reconcile the role of government with that of the private sector, and even include civil society, so that there is a coherent action from global to local, from national actions by government to the local level by the
yeah, perhaps I could just add up.
Practitioners. Yeah, so one party cannot handle it all. Ensure that, yeah. So I think someone wanted to add up something.
Yeah, Busiso, did you want to say something?
Yes, so I just wanted to say, in that same line of thought, so we've got Agenda 2030, which is very clear in terms of locating, that focal point of accountability with the state. And I think part of that, therein lies the problem. And I think leading up to the summit, maybe that's something we also need to zone in on, to say it cannot be that, there's this focus on the state when it's clear that, we haven't really figured out how we determine value within the food value chain, for example. And then that brings in the idea of business and human rights, but more so leading to the fact that what is the content of the right to food? So for me to say I have a right to food, is that government's responsibility to feed me, or we are talking about an enabling environment that can ensure that I have access, to food and nutrition? But then, rightfully so, then that means that we have to bring about a framework that then governs capital interests and, the role that they play in the food value chain.
Thank you so much. We'll take a question from Stephen Ogweno. I believe you'll speak.
All right, thank you very much, Mary, and an interesting panel, really. I had 3 questions and I'll drop them very quickly. So one is, food labeling is, whilst we're talking about nutrition and children, food labeling is a big player in this. So what is the role that the government is doing, or what have you seen that is being done that is curbing food labeling to ensure that food is labeled correctly, so that what are some of the best practices? Because from the speakers and your profiles, you've worked very extensively in very many countries. And so what are some of the best food practices that exist? And finally, back to the question that was asked, the very first question is, what practical things can we do as young people today, besides, the work on advocacy and the human rights angle? What other practical things, can you suggest that we can do today to begin to, change this conversation? Thank you.
Okay. Yeah. In fact, when you talk about food labeling, there are the best practice is to ensure that whatever constituents the food has fully presented for the consumer to understand what he or she is consuming. Now, what the role of that is the fact that when the food is adequately labeled, you can ensure that at least you can be certain about what goes into your system, so that if it's about caloric intake you want to reduce, you know that it contains such and such percentage of calories, and therefore you may want to cut down on it, or you may want to consider a different macronutrient or certain elements. So food labeling is very, very important, and it requires the certification systems that will ensure that whatever is put at the label correspond to its content, and that can be a challenge when there are weak monitoring system and food safety infrastructure. So when you take Thailand's agricultural food system, for instance, they have a food safety certification system that constantly ensures that whatever goes into the market corresponds with whatever has been declared. And so consumers know what they are consuming. But do we have that across Africa? Well, you take Ghana, for instance, we have the Food and Drugs Board or Food and Drugs Authority that regulates the kind of food that is advertised, that is labeled. And so these systems, although they are put there, but we still notice that there are gaps when it comes to our setting, in the fact that by the fact that there are certain localities that you find expired products, you find food products that seeks to contain certain nutrients, and you check and it's all about sugars, and food additives that do not really correspond to their contents. And so it is quite dicey when you look at our African terrain and trying to see how best to resolve these. And what practical things the young people can do to change the story. We worked on a couple of ideas in our agency, that is Agency for Health and Food Security, and we noticed that when you take we worked on mining. In fact, we promote vegetable consumption among the population, so that by consuming fruit and vegetables, we are sure that we build up our nutrients needs, we improve our immune systems and all that. But then we assessed vegetables, and we saw that vegetables on markets contains heavy metals, largely because of the soils on which they are produced. And we noticed that mercury, arsenic, cadmium were high, lead were high in these food substances. And so are we then going to say that by virtue of these heavy metals going beyond the permissible limits in crops, whether we should stop eating vegetables? So these are things that the youth should be concerned about. Environmental degradation definitely affects the quality of the crops that we eat, and therefore there should be more campaigns for people to be environmentally conscious with the production systems, so that the food products that we bring up for consumers are safety assured and can provide the nutrients that we need. So that if you are consuming foods that are high in these heavy metals, that means that your risk of cancers and other diseases are quite high. So there's that need to connect production to processing to consumption and all that. And that is the essence of this food systems approach. And I think that as we go on, we may be able to talk more. Thank you.
Thank you, Kwaku, for that elaborate response. I think that really gave some good insights. I just wanted to add as well that we work with partners in Latin America, and as I'm sure some of you know, or many of you know, that both in Chile and Mexico, they have worked on these traffic light or food labeling systems that I think are inspiring many countries around the world, not the least my own. But I think we'll move on to the next question, which is from Andrew Robinson. For agricultural production, more than 80% globally goes to animal feed, which is extremely inefficient use of energy, which is NB with climate change, but is not as nutritious as food and veg. How should the agricultural sector adapt to addressing this? Do any of our panelists want to answer that or speak to that? Position?
Okay, I don't know. Well, okay.
Yeah, look, I'll
Yes,
just
please go on so that if I need to add up.
All right, but I guess for me as well, you know, the gravity of this. Yeah. Also, I was just going to say, I think for me, the gravity of the situation, you know, even expresses itself when we realize that, you know, off-farm activities in particular, you know, are a growing share of, you know, food system, you know, greenhouse gas emissions and so forth. And we also need to, you know, speak about this in context to agriculture and its role to a changing climate, and then how that also erodes, you know, that agency for those at the bottom of the pyramid. But I guess for me, you know, more than anything else, we also have to zone in on that journey, you know, from farm to fork. And I think for me, therein lies an opportunity when we're looking at food waste in particular, you know, because for me, I'm approaching this, you know, from a hunger, destitution, you know, malnutrition, and like a very dire sort of perspective. And I think, you know, when we look at wastage and that type of issue, then you have to then ask yourself, what perhaps can a legislative framework offer in terms of, you know, guiding some of these, you know, surplus sort of like, you know, food production things that speak to some of the ills of the food system, you know, because as is, you know, in South Africa at least, we do not have the framework that allows us to intervene and influence that agriculture sphere insofar as, you know, the role that capital interests play. So for me, I think it's about legislative framework. What can it do in terms of influencing the agriculture space? And then more so, how do we also ensure that the food system is efficient in terms of that journey from farm to fork? Yeah.
Thanks.
Yeah. Okay, so just to add a bit, we know that animal protein provides the kind of amino acid that the body needs fully.
Okay, thank you, Kwaku. I think we will, sorry, your connection is a little bit, that's okay. Yeah. It's just your connection is a bit choppy, so you keep coming in and out. But I think we've had some great conversation here and really good inputs from our speakers, and thank you so much for all of your questions.